Thank you for the opportunity to share about the WHO International Scheme to Evaluate Household Water Treatment Technologies. WHO's basis for interest in household water treatment is that until we reach the ultimate goal, which is for all to have safe and reliable access to pipe supplies, household water treatment provides an interim solution for the 1.8 billion without access to safe and reliable drinking water. And as an important primary health intervention, these products can reduce diarrheal disease by up to 45% when effective methods are used correctly and consistently by populations most at risk. And there's even more recent evidence that this may be actually as high as 61% effective. And so when I say effective methods, that would be one that is appropriate for the context, so the water quality issues will be used and can actually be relied upon to work as indicated or as marketed. But selecting a product can be really difficult. There's the issue of market diversity. So many technology types, such as various kinds of filtrations, various kinds of disinfection, combination technologies, and always new and emerging technologies. So that's why there was this need for a health-based performance evaluation to help guide and inform this selection. But many countries don't have a comprehensive health-based regulation, nor the technical capacity to implement WHO recommendations for evaluating household water treatment. So, WHO established an international evaluation scheme for household water treatment to fill the need for rigorous health-based assessment of household water treatment technologies based on the WHO recommendations. The scheme promotes and coordinates independent and consistent evaluation of household water treatment products based on WHO criteria. And beyond the product evaluation, the scheme has the objective to strengthen the technical and regulatory capacity within countries, ultimately working towards establishing these to be in-country evaluations. While chemical contaminants are of concern in different locations and different kinds of chemical contaminants, the scheme is limited to performance against microbial groups of concern in water. These are bacteria, virus, and protozoan cysts. And the reason for limiting to microbiological performance is because microbiological concerns are ubiquitous. With this, the aim is to guide WHO member states and procuring UN agencies in the selection of technologies and support national governments in related functions. So the audience for the scheme evaluations are actually those who are procurers, those allowing products on the market, researchers, and here I've listed national certifiers, regulatory authorities, researchers, manufacturers, and implementers. And the expectation is with time, local governments will manage, which I had mentioned earlier. The scheme is supporting building national capacity, both on the technical side and on this regulatory side. So where is the scheme now? The scheme to date has received 100 expressions of interest, and 51 of those products have been evaluated. And I'm not going to go into detail today about the performance outcome, but I urge you to read the reports on the scheme website to really have a chance to dig into the details. But for a high-level mention, I want to highlight that a variety of technologies were evaluated, which is great because the scheme is very promotive of there being options available for those making selections. You can see the scheme has a tiered approach to assigning performance, which you can see across the bottom of the graph as a 1-star for targeted protection. This performance outcome is assigned when a technology meets 2 of the 3 microbial groups requirements. And then there is a 2-star and a 3-star called comprehensive protection for those products that meet performance criteria for all 3 microbial groups reduction criteria, either to a protective or a highly protective level, 2-star or 3-star respectively. And you can see here that in this kind of summary slide that 8 of the 51 products evaluated failed to meet the minimum performance criteria for any of the tiers. And this here is seen as little or no protection. And sharing a few key takeaways, one of the most interesting was that manufacturer quality control is highly variable. The testing is performed in triplicate, and when the 3 products were tested, there was notable variability among the replicates, sometimes leading to failing to meet the WHO scheme criteria, in fact. And of those 8 products I showed that did not meet any of the scheme criteria, 6 of those 8 products showed manufacturing quality management issues, leading to not meeting a tier or lever or performance criteria. And even among products that pass, but did show inconsistency among replicates, reduction ranged from meeting minimum requirements to exceeding top tier. So very interesting. If you read the reports, this is expanded upon, and you know, the really good value that the scheme has added here is this feedback was useful for the manufacturers who were able to tighten up their quality control based on these results. Key takeaway 2, while you can have some level of expectation about what a technology type may be capable of, there's still a need to evaluate because variation exists. The report gives an example with membrane technologies, the evaluation of different membrane technologies and their variation between different manufactured products. Takeaway 3, chlorine is not a simple evaluation and application. Here I'll just talk about the evaluation. And to have a solid, consistent laboratory evaluation, you need to consider the complexities expected in natural source waters, particularly with organic matter and type, because it really impacts chemical demand. And from the application side, you know, the user has to remember it's just not about the visible turbidity in your source water. Round 2 report really goes into highlighting the impact of natural organic matter on chlorine disinfection effectiveness for different products. Takeaway 4, understand water quality and technical limitations. You know, I mentioned the lab reports again because the laboratory evaluations of the various technologies using both a general test water mimicking a high water quality like groundwater and a challenge test water mimicking a lower quality water like a surface water really showed the level of strength and weakness for different technologies under the 2 water scenarios. Simply put, technologies have different capabilities and weaknesses, and the selection should be informed by the user's household water quality. It's our hope that this also conveys the message to manufacturers, the need to consider a wide range of water quality and product development, perhaps through the use of combining treatment over a single technology approach. This may mean like pre-filtration to remove turbidity before the water reaches the UV technology portion in a system. Key takeaway 5. Wow, I don't think any of us expected to have the scheme evaluation bring to light how important clear and concise and complete use instructions are. We saw strong impact to log reduction performance based on the instructions that differed for very similar products. And a few tips. Use instructions in multiple language with pictorial steps are advantageous. Order of operation for multi-stage treatment products must be specific and easy to use. Adapt use instructions that consider influent water quality, like double dose if it's a chemical contaminant and the water is known to be quite, of low quality. And in summary, the scheme has completed 51 product evaluations, and these have been important for informed planning and responding in emergency response, informed national guidelines in Ukraine, removed ineffective products from the Ebola essential interventions list, has been a market differentiator for manufacturers seeking new market. So we're excited to see the list of evaluated products grow as the evaluations are ongoing. The real emphasis moving forward will be on supporting countries with strengthening in-country capacity to do their own evaluation. This is from a laboratory and regulatory perspective. Again, we mentioned important to continue impact will be the ongoing communication efforts about the scheme. So I thank you for the opportunity today to communicate about the scheme. Thank you.